If it's along the shin, for shin splints, wrap it up, turn on the current. Shin splints, the whole shin. Internal shins. Quad pad, hamstring pad, torn hamstrings, everybody gets those. If you're a runner and a sports person, it's an easy way to prevent a lot of hamstring injuries. The hamstrings connect to the knee and to the pelvis. God made them a certain length. If your back goes out of alignment, your pelvis gets twisted, or your sacral or sacroiliac joint becomes involved, and it's not stable or where it's supposed to be, the way God made you, posturally and gravitationally. Okay? The pelvis will shift, and the points where the hamstrings connect to diverge or converge. Now, if they diverge, the hamstring becomes stretched before you even try to stretch it and run. Bingo, you got a tear. Okay, the opposite side, if the pelvis goes one way on one side to cause the hamstring to be stretched, on the opposite side, the pelvis rotates a different direction, which causes the hamstring to converge or to shrink. It can't contract as effectively as it's supposed to because God made it to be a certain length. So this side will be flaccid or not firing and weak. Okay, this side will be tight and probably tear or strain. Because this side is weak and flaccid, she will then kick in some other muscles in her low back to try to compensate for the weakness in the hamstring. Strap in for the hamstring. I probably should have the patient lay face down. Let's do that so we can see the hamstring. What do you think, Kels?
I think that's a good idea.
All right, let's lay face down. Good. Fine. So, again, put the pad, calf, that, and this long pad. Okay, anterior tibialis muscle, shin splints, inner, medial, lateral, calves. Okay, wrap it on the foot, or put it on the foot for plantar fasciitis. Wrap it around the toes. Okay, wrap it around the toes for turf toe. Heel spurs, right, here's these E-stim points, right on the heel. Right on the heel spur. Right around the Achilles tendon. Tremendous for Achilles tendon. But again, the Achilles tendon can only get well if you make sure that the Achilles tendon that's attached to the heel and attached to the gastrocnemius muscle, that the bony area is lined up. So many people come in and they got Achilles tendon problem. You can treat it with therapy all you want, but unless you normalize its length, put it back in its proper position by adjusting the navicular, the talus, and the navicular, the calcaneus, and the talus, you're really never going to get well.